This is the first presentation on the gynecological examination. It will include some introductory slides, and then it will begin to look at the gynecological exam. There are 5 parts, if you want to the gynecological exam, but this will have 3 of them: the breast, and then the external and the genitalia, and the pap. Those 3 parts will be covered in this PowerPoint. So gynecology is the branch of medicine dealing with diseases of the reproductive organs of the female. Obviously, medicine's job is to check signs early, because the earlier the problems are found, generally the better outcome of treatments. So as we said, this is basically focusing on the gynecological exam. There are 3 main parts: the breast, the pelvic, and the rectovaginal. Now, the pelvic is broken into 3 parts: the external inspection, the collection of the pap, and then the bimanual. And in this PowerPoint, we will look at the breast, the external genitalia observation or inspection, and the pap. The patient is in the supine position for the breast exam. Obviously, the purpose is to check the breast and nipples for swelling, dimpling, puckering, or any changes in the texture of the skin. The nipples are checked for bleeding or discharge. Not only is the breast checked, but so are the axillary lymph nodes, looking for lumps, hard knots, or thickenings. Here again, the physician will do this, but the medical assistant may do the patient education on monthly breast exams. There is some discussion whether this is good or not, but the basic ideas are that the hand obviously is behind the head to bring forward the tissue, and then the 3 pads of the pads of the 3 middle fingers are used to perform the exam. But whether the physician does it or whether a patient is doing a self-exam, I would like you to know the 3 patterns that are used to check. They are circular, which sort of starts at the middle and circles around, going to the outside. The wedge, which are a series of short strokes starting at the nipple and pulling out to the edge, sort of in multiple wedge palpations, if you want to call it that. And then the vertical strip, which will start and go up and down, starting at the beginning of the breast. And obviously, all of these go into, as it mentioned, a little bit of the axillary lymph nodes. So, like I said, basically you will know the purpose of it. The position is in the supine position, and then you will know the 3 patterns used for checking. The pelvic exam is used to check out the size, shape, and location of reproductive organs, and obviously looking for disease. And as I said, it consists, I call it, of 3 parts: inspection of the external genitalia, vaginal, and cervix, collection of the pap, bimanual exam, and then some places call the rectovaginal a separate part on its own. But with the breast, this gives a total of 5 parts, which you will discuss, especially when you're doing your comp. The medical assistant remains in the room, so there's someone in there besides the physician as this process continues. And here again, you will know the patient is in the lithotomy position, and this is kind of a exposed position, so we need to be sure that the draping is proper. And of course, you will do this in your competency. So looking at the first part, the inspection of the external genitalia, the vaginal, and the cervix. So the vulva outside area is looked at for swelling, ulceration, or redness. And then this speculum is inserted. And there used to be metal ones. There are probably still some around there, but hopefully they're not very popular any longer. They're cold and they're heavy, and you don't get as much visualization, and they need to be clean and sterilized, where the plastics are clear, one can see through them, and they're disposable, and a lot of them have a little light connected to them. Here again, a speculum may be warmed or moistened for easier insertion, and so it doesn't feel so bad. There are warming drawers, there can be warm water, and they can be lubricated with a water-soluble lubricant for the pap. There are some old ones that are not water-soluble, that are sort of oil-based, those could be used for exam, but they can't be used for the PAP because they cause the cells to stick together. So that isn't really good at looking for it when one goes to make slides and look at the cells. On this one, like I said, the physician then not only had he looked at the outside, but now he looked at the vaginal canal and the cervix, looking for color, lacerations, tenderness, nodules, and discharge. At this time, if there is any discharge, he or she may get a swab or a transport media and take a sample to be sent off to look if there are any microorganisms causing a problem here. So the second part of the exam is called rigorous collection of the PAP. And the PAP is a cytological exam, meaning that somebody's going to examine, a cytologist and a pathologist, look at the cells to see if any of them are atypical, because some are cancerous if they're atypical, and some ones that are leading to that. The patient may have instructions. Here again, sometimes these are, not done. They're not as necessary today, but sometimes they will say not to come during the menstrual period, or no douching, sexual intercourse, or tampon. But those are, I say, not as relevant anymore as they used to be. But in the specimen collection, which the physician will do, but you will pass the physician the implements needed, and you may actually be making the slides or putting the specimen into the little vial, which we'll talk about a little bit shortly. But nonetheless, we're looking for squamous epithelial cells of either the vaginal canal, the cervix is most often the focus, or what we call the endocervical area. But we're collecting up these cells. And ways they can be done. Here again, there's the direct smear or the liquid-based preparation. The direct smear generally uses a spatula or a brush, and you will get to see all of these when we do the competency demonstration. Excuse me. And there will be labeled slides, and the physician will use the spatula or brush to collect up those cells, and they may hand it to you, which you will then smear on the slides, throw the spatula away, and then these slides must be sprayed with a fixative after they dry. Otherwise, if they continue to dry, they'll dry up and the cells won't be really very recognizable. You'll put the slides in a container, and you'll see when the comp demo is done, they, along with some information, will go off to the lab. The liquid-based preparation is most often used today. It has been an improvement because it can collect up and have a larger amount of cells to be observed, and it gets rid of a lot of this debris and other things that are really not important that might get in the way. So a brush may be used, but most often a broom is used. And here again, collecting up those cells, which the physician will do, and then he or she will pass that to you, and you will take this little broom or brush and you will swish it around for a certain amount of time in this vial of liquid, and then sort of tap it on the sides. Obviously, the broom or brush will be disposed of in bio. You'll put the lid on, and then this will be sent with that information, and that will be discussed with the competency, will be sent to the lab. And it is processed by an automatic processor that gets rid of all the debris and then brings all the cells in a nice large collection. So, like I said, this has been an advancement over the direct smear. But I would like you to know both kinds, because on your certification, you might find questions about each of them. There is something called the maturation index. I'm really not going to go into it. There's some information here. I believe your book has additional information on it. Just know that it is actually an endocrine evaluation. So it's looking at like the quality of the cells, not whether they're malignant or not. It's looking kind of how the hormones have affected them. So like I said, that's all you need to know about this at that time. The Pap smear is evaluated by the Bethesda mission. Well, how about the Bethesda system? This certainly is a very all-inclusive. It gives the physician lots of information. First of all, it will say what kind of prep it is, direct smear or liquid. Then it will say if it's satisfactory or not. Then it will give a general categorization. One of three. Negative, so negative means the cells look like normal, regular cells. Or, second one, epithelial cell abnormality. And the other, it means that we couldn't really truly call it abnormal at this time, but the way it looks, it isn't purely normal. So those are the three general categories that come in this part. And then the interpretation or result gives one of 5 very specific descriptions. So negative for intraepithelial lesion or malignancy. Hence, the cells look normal as they should be. Atypical squamous cells of higher risk. Here again, that's that category. There's some changes occurring that might look like that a change might be made. Low-grade squamous epithelial lesion. Something's going on here. Can't quite call it cancer yet. High-grade squamous epithelial lesion. Definitely cancer here. And obviously carcinoma. Definitively. The cells look like they are at the cancerous level. Here again, it will tell whether computer imaging was used, and that's often really good because it can pick out a lot of things. It can give a greater view of what's going on. And then additional testing can be done on this specimen, and that's generally when it's the liquid prep. It can be used for diagnostic testing, molecular diagnostic testing, especially for HCG, and gonorrhea. It can also do chlamydia too, I'm pretty sure, and there's a couple other tests today that it can be done. But here again, this will be noted at this point on that report. So, moving on, you'll move on to finish the gynecological exam in the second PowerPoint.